But I think it's really important to realize that you don't have to snack. Number one, you don't have to snack. I call it power packing meals, where we're adding extra fat, trying to keep volume low but calories high.
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona from the Kidney Coach website and Beat Kidney Disease Solution. And I'm joined again today by the beautiful Jessianna Seville from the Kidney Nutrition Institute. So Jessianna, thank you again for joining me.
Thank you for letting me be here. I'm excited to share some solutions with people.
So let's get straight into it. So snacks. Does everybody need to have a snack? They're following a kidney diet.
This is a great question. Now, when I was in school, a couple years ago, many years ago, we were taught, like you should have 6 small meals a day, like eat all day long, and that way your metabolism always stays high, etc. I don't believe that is true anymore. So we do not push snacks for all of our patients, and I don't think that's relevant. But there is sometimes when a snack is very, very useful. It's good to know what some tidbits are, so you're not just hanging on for dear life and hunger. But I think it's really important to realize that you don't have to snack. Number one, you don't have to snack. You may need to snack if you need more calories, but you may also want to not snack just to give your body a break. So it's really, across the board, there's a little bit of personal preference, and then there's a little bit about what's healthiest for you. So there's not a one size fit all dogma about snacking.
Yeah, that's my understanding too. And we were taught the same thing. You just eat all day and that balances out your metabolism. And then intermittent fasting came along. And we know how good it is to give the digestive system a break. So just to give people a little bit more clarity, and someone sitting here going, well, how do I know if I snack or not? If you had a patient in front of you that asked you that exact question, how are you organizing, for want of a better word, people into snack and non-snack groups?
Good question. So the first people that we generally almost always include snacks with are people that are losing weight really fast, and they just can't seem to get enough at meals. Like, we'll do everything we can. I call it power packing meals, where we're adding extra fat, trying to keep volume low but calories high. But there are just some people where they're just not going to get everything. And if you're dropping weight very fast, even like you're cutting protein, you're cutting all these things, and we see tons of people that are just dropping weight really fast, which I think is a risk factor in and of itself for progression of kidney disease. Those are people that we will work in strategic snacks for them. So definitely with weight loss. The other group of people that I find snacks can be helpful is there's some people that they just always have their whole life been kind of grazers. So they just eat a little bit, and it tends to be very intuitive for them. So they have always just followed their hunger cues. And so they eat just a little bit all day long. And there's no reason to break that pattern. I find a lot of those people are normal weight, but they're small eaters. I just call them grazers.
Yeah. That's me.
Eat all day. So those are people where snacks can fit in really well. Obviously, for people that have diabetes, where maybe it hasn't totally been ironed out yet, the high and lows of blood sugar, which can be over time, and then you can really cut back on snacking, which I think is great. But at the beginning, as people are trying to get their diet settled and in a good rhythm that works for them, I really think it's important to have some smart ideas on how you're matching your meals to your blood sugar medicines, or just your blood sugar patterns in general. Those people not only need to have a strategic snack in case their blood sugars drop low, but just initially as they're transitioning their diet to being stable blood sugar, they may need to have snacks in as well.
If you want to know more about what we do, head to kidneycoach.com and you'll find all the information on there, including our program and our supplements. And remember to subscribe to this YouTube channel. It means you will get informed anytime we put up new content. Thanks again for being part of our community. We look forward to seeing you next time. Bye.